Hello, thank you for taking the time to learn about the Athlete Movement Index Research Program. My name is Dr. Matt Daggett, Principal Investigator for this research program. The Athlete Movement Index Research Program has been created to help identify objective, data-driven ways to reduce injuries in our young athletes. There has been tremendous growth in the participation of youth athletics over the past 30 years, which has resulted in an exponential increase in sports-related injuries. It is estimated that in high school athletes alone, there are over 2 million injuries per year. One such injury is to the anterior cruciate ligament. It is estimated that roughly 3% of all athletes will suffer this devastating injury. The individual and societal costs from this ACL injury are staggering, with an estimated 20,000 to 30,000 knee replacements performed each year due to subsequent arthritis from patients who have had an ACL injury in their past. ACL injuries are just one example of the tremendous impact athletic injuries have on our student athletes and our society. Many athletes will suffer an injury during competition that will continue to impact them as adults, causing either chronic or future pain. Despite the staggering number of injuries that occur in young athletes each year and the subsequent impact of these injuries have on the rest of their lives, the medical community has placed a historically relatively low value on decreasing these injuries. Consider that there are over 14,000 articles on ACL injuries in the medical literature, and yet very few are on ACL prevention. There is also limited research identifying the risk factors for injury, and even less investigating interventions to improve those risk factors. Furthermore, there are few objective criteria that exist for the physician to identify when a safe return to play can be performed. This results in sometimes delayed return to play and oftentimes, unfortunately, an increase in injury recurrence. As a medical community, we are doing our young athletes a disservice by not focusing more on injury prevention, and this program aims to change that. The goal of the Athlete Movement Index Research Program is to help reduce the number and impact of injuries in our young athletes. The Athlete Movement Index Research Program has brought together very unique community stakeholders to develop a pilot study which has been reviewed and approved through the University of Central Missouri Institutional Review Board. The purpose of this study is threefold. First, we want to identify risk factors for injury. Imagine if we could identify who was at risk of injury before we took the field. Secondly, we want to identify what the most successful injury prevention programs are, both on an individual and team basis. Third, our goal is to identify objective measurements for safe return to play after injury. The study itself is divided into three phases: screening, tracking, and analysis. First, let's talk about screening. Injury screening will occur both prior to the school year and throughout the year as new seasons of sports commences. Young athletes will have the opportunity to attend screening days and participate in different stations that track efficiency and movement. This screening process will only take about 10 to 15 minutes to perform, and the measurements will be recorded and kept in a password-protected database. At the completion of injury screening, the athlete and parents will receive the results, including any risk factors that were identified. In addition, they will also receive some complementary exercises to help address the deficits that were identified during the screening process. Each participating athlete will also receive a complimentary 30-minute training session and associated protocol to address and help to reduce the risk factor for injury. Second, tracking. Throughout the course of the year, athletic trainers will continue to track injuries that occur and record them in a cloud-based, password-protected software program. Until now, tracking these injuries has been difficult and incomplete. However, through the utilization of complex database software that is password protected and currently in use at each school to track and record injuries, we are able to record more accurate injury data. In addition, we can also track other variables such as ambient temperature, type of turf, and any other variable that may lead to an increased injury risk. At the conclusion of the school year, the injury statistics for the school district will be known. The screening results measured prior and during the year will then be connected to the injury statistics that were recorded during the academic year. Personal identification information will then be removed. By combining the injury screening information and the injury information that was tracked during the year, it will allow us to perform advanced statistical analysis to identify any correlation between specific risk factors or injury screening tests to a specific injury or injury pattern. The findings will then be reported to both the school district and medical community. The information obtained during this year will allow for a better understanding of the causes of injuries. In addition, it will provide insight for the development of new and innovative injury prevention programs that may be able to further reduce injuries in athletes. The information gathered will also provide guidance for the program in the years to follow. Participation in the study is completely voluntary and requires informed consent by both the young athlete and the parent if the athlete is under the age of 18. In the second phase of our Athlete Movement Index research program, we will be looking at injury prevention studies and trying to identify comparative data between different types of both individual and team programs. Some examples of these individual and team injury prevention programs include the Santa Monica program or the FIFA 11 program. The third portion of the Athlete Movement Index research program will be looking at safe return to play. The goal of this portion of the Athlete Movement Index research program is to develop new standards for return to play decisions for the entire medical community, one that is based on data and objective analysis. Imagine if we could identify which student athletes were at risk for injury or recurrence of injury before they took the field, and imagine if we could identify new and innovative ways to reduce and prevent some of these injuries. In the end, we have to ask, is this the best we can do? In summary, the Athlete Movement Index research program was created to help reduce the injuries and impact of those injuries in our young athletes. We hope that our findings will help not just local athletes prevent and return from injury sooner, but also athletes worldwide from the publications that are produced from this abundant research program. We don't think so, and we hope this program can make some strides in improving the health of our young athletes.